Welcome to North Bay Regional Health Centre. More Time to Care is our quality and management system that we've been developing over the past year. More Time to Care actively involves patients, staff, physicians, and volunteers in system transformation and quality improvement. Over the past year, we've been developing the foundational elements for the system. We're pleased to share the team's progress to date.
The More Time to Care management system is a unique 22-element model that was created for the North Bay Regional Health Centre to transform the way we do business and care for our patients and families. These elements have been developed to help streamline our work processes, to free up time for care, and partner with patients and families to improve the patient experience. In January of 2014, the senior leadership team created an organization report card to keep us on track in achieving the goals set out in our strategic plan. By tracking our performance and our work, we can identify the areas requiring assistance and keep focused on the priorities of the hospital. This work is displayed in a strategy room where the senior leadership team meets regularly.
I think it's important to have data as in today's world, evidence-based medicine is important. Medicine is an art based on science, and science needs data, and how we use that data and implement it is really the art of medicine.
On March 3rd, 2014, the hospital's transformational journey began with the selection of 6 value leaders, chosen from frontline staff of all areas of the hospital. Their role is to help the organization along this journey by bridging the quality improvement initiatives to the operations of the hospital. How do you know what needs to be improved if you don't measure it? The Performance Scorecard is the tool that was developed to track and measure department performance. This identifies department challenges and strengths and will help align our entire hospital under one vision. On March 5th, the value leaders and the quality team held information sessions where they assisted the groups in selecting the metrics to track and create their first scorecards. It was a learning process for everyone. By the end of what we called March Madness, more than 80 scorecards were deployed across the entire hospital.
It's about time that we start applying metrics and data to all of our complaints in medicine. Prior to me coming onto this role, we weren't very organized. We had a lot of legitimate complaints, but with no data to back those up and then to incite change. Now we have data, we have value leaders, we've got all kinds of support within More Time to Care to lead to change.
In April of 2014, we launched our first hospital-wide experiment. Paper versions of the scorecards were used to trial the format, layout, and location of the scoreboards. Changes to titles and layout were recognized during this process. We now had a place to post our metrics, and the tracking began. This visual management tool allows patients, families, and employees to see at a glance the team's goals and performances. Once each scorecard had been finalized, teams gathered each Friday from April to June in the auditorium to report out on their department's selected metrics and initiatives. The report out provides an opportunity to share, learn, and celebrate these experiments with staff that would not normally see them. Report outs included theme songs, theater lighting, costumes, and each team was encouraged to add their unique flair. Report outs create a sense of energy and pride. On June 26th of 2014, 3 areas of the hospital were selected to become our pilot or test areas, where More Time to Care tools and elements could be implemented and trialed before being introduced organization-wide. We called these areas the Deep Dive. Our brave pioneers were perio-operative services, Deer, Heron, and Owl Lodges of the Mental Health and the Law program, and the pharmacy.
We brought our flippers and our snorkels and our masks, and we were really excited to get up on stage when we knew that we were chosen to be a deep dive.
We put our scorecards into action and began huddles in July of 2014.
I'm still amazed to this day at how we can bring our team together as a whole to work on reducing inefficiencies and to work on improving patient care.
Huddles are a 15-minute stand-up meeting that provides all care team members an opportunity to come together on a regular basis to improve their day-to-day work and celebrate experiments.
And our huddles have become quite popular on AIPU to the point now where our patients want to attend our huddle on a weekly basis, which is amazing. I never thought this would happen actually, so I'm really happy about that.
A step-by-step guide was used to teach teams how to facilitate their huddles and to ensure everyone would be following the same process. This was our first organization-wide standard work document.
The staff is engaged to a level that I have never seen, and I've been nursing for 30 years, so it's really, really exciting.
The next step on our More Time to Care journey was the introduction of the monthly scorecard review. This tool brings managers, directors, and vice presidents together to reflect as a team on the performance of the department's scorecard metrics. This initiative helped create a supportive environment to encourage experimentation, share lessons learned, identify opportunities for improvement, overcome barriers, and create value through partnerships.
I think the advantage of the monthly scorecard, it is dedicated time where you can have that dialogue. And so, the VPs have huge portfolios, they have a lot of responsibilities, and so it's an opportunity to have a dedicated hour of time where you can talk about different issues and talk about the service and have that opportunity to communicate information back and forth, both for the VP to be able to communicate information down to the middle manager and eventually to frontline staff, but also from the perspective of being able that a middle manager has an opportunity to communicate directly with his VP and director at the same time around the challenges that they're facing with a particular scorecard issue. Or any issue within the department and service for that matter.
After several weeks of experimenting with the scorecard layout, headers, and huddle locations, permanent standardized 8x4 feet boards arrived. With many hours of hard work, all of the boards were in place across the hospital and at off-site locations within days. From August to September of 2014, the deep dive areas and their stakeholders, along with a team of facilitators, gathered to complete a value stream map. A value stream map is a pictorial representation of how things flow through the system through the eyes of the patient or consumer. Our unique approach included data and information from risk management, accreditation, and patient and family partnered care to help identify the current state of the areas and guide the teams towards prioritizing projects to improve the patient or customer experience in their areas.
Having the opportunity to come back and work with staff members here at the hospital gives patients like me power and it gives us a feeling of being able to make a positive difference and making change in a collaborative manner rather than things being done without our input. So it's nice that they take the time to do that, and I'm glad to be part of making a difference.
October 3rd, 2014 marked the launch of our patient and family partnered care journey. The first initiative was the Patient and Family Experience Survey. This information guides us to make decisions that matter most to the patients and families.
And with the survey, it helps us tie together the whole experience in the continuum of care.
2 additional patient and family partnered care initiatives were piloted in October, NOD and It's Safe to Ask. NOD stands for Name, Occupation, and Duty. Staff are expected to identify themselves and their role clearly at the beginning of any interaction with a patient or family member.
The patient is going to have questions. Provide them with an answer. If you don't have the answer, let them know that you're going to look into it.
Safe to Ask reinforces and encourages patients to ask questions and become involved in their personal care plan. Both initiatives focus on creating a culture of dignity and respect, where we listen and honor patient and family perspectives and encourage sharing of information. The purpose of the daily status sheet is for the department manager to meet with their team leads in order to identify issues or concerns staff may have and act on them as needed. This problem-solving tool, trialed in the deep dive areas, helped these managers move from reactive to proactive planning. In December 2014, several improvement projects had been completed, and it was time to start sharing the results across the hospital. People were amazed to hear the successes of the projects that had been implemented in the various areas, and it was a great opportunity to recognize the excellent work that staff are doing to improve the hospital and patient care.
It doesn't have to be a big project. It can be something small, and you can alter how you want the report out to be. And I think the main thing is people are being celebrated for the work that they do.
The North Bay Regional Health Centre kicked off 2015 with a great start. A weekly 2-hour no-meeting zone was introduced organization-wide in January. The no-meeting zone provides regular protected time for managers, directors, and the senior leaders to leave their offices and to go to where the work is happening. Go See Learn is the tool that's used during the no-meeting zone to have patients or staff conversations and observe processes. This gives our leaders an opportunity to understand what is working well, what is not working well, and what support the team needs.
OC Learn and No Meeting Zone is an opportunity to go to staff, see what they do, and recognize them in the moment when it matters the most. It's an opportunity for us to be there and to really get to know the workings of our organization as leaders, and to really connect as leaders and frontline staff, leaders at all levels, and work together.
We have discovered that the implementation of the More Time to Care management system is an ongoing journey that cannot happen overnight. We have undergone much change since our unique 22-element model was created to transform the way we do business and care for our patients and families. This has been a fully packed year with high pressures and competing demands, and we are proud of how far we've come.